Hello everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about autism spectrum disorder, which we often call it as autism. So broadly, if we want to understand autism, we can call it as a developmental disorder, and specifically it is a social disorder. So here, if we look at the term autism, we can find aut, right? And aut means self, or aut refers to self. So wherever there is aut, you can that refers to self. Now that means a child who is affected with autism, or an autistic child, would be always too much involved in his self. So here, I told you two things. The first thing is that it is a developmental disorder, and the second thing is that the child would be, too much involved in his self, right? So it is a kind of disorder where it affects the brain's ability or brain's normal development of social and communication skills. So we can call it as a neurodevelopmental disorder. And we are also saying that autism spectrum disorder, right? So here there is no particular signs and symptoms that we can see, but each child would have different experiences, different kind of signs and symptoms, and there would be a spectrum of signs and symptoms. So for each child, these symptoms are different, their experiences would be different. Now, the signs and symptoms are mostly, it appears within the first 3 years of life, and also, as I told you that it is a kind of disorder where it would affect the brain's normal development of social interaction and communication, right? So what would happen? The child would be removed from social interaction and communication. So in autism, basically what we can see is that the child would have difficulties, or the child won't be able to socially interact or communicate. So next, let us move on to the definition. So it is defined by the presence of abnormal and or impaired development that is manifest before the age of 3 years, characterized by abnormalities of social development, communication, and restriction of behavior and interest. So the first thing is there would be abnormal or impaired development. That means, as I told you, that it is a neurodevelopmental disorder, and we also know that in this age, in this developmental age, the child would have several developmental milestones, right? So according to their age, they would achieve these developmental milestones. So social interaction and communication is also a part of that, right? So as we grow older, we learn how to make friends, how to interact socially, how to communicate. So these are something that as we grow older, we learn these things, right? So these are also a kind of developmental milestones. But this is in autism, what happens, as there would be neurodevelopmental, it is a neurodevelopmental disorder, and also we learned that here, it would affect the normal development of the social interaction and communication abilities, we can say. So because of that, the child would have difficulties in social development. The child would be, would not be able to interact socially. The child won't be able to communicate with other people, and also they would have restriction in their behavior and interest. Now, I told you that it is a spectrum disorder, right? That means, there are several signs and symptoms which falls along this spectrum, right? So there are certain key features, or we can say key signs or symptoms, which would be, experienced by each child. So the first thing is social communication, social interaction and communication. So basically, as there is lack of social development, the child doesn't know how to, interact socially, and that's the reason they won't be able to mingle with other children, and they would prefer to be alone even when they are with group of other children. The next thing is joint attention. So if you see children, their behavior or their characteristics is something that if they like something or they are interested about something, they always share it with other children or with their parents or siblings or friends, right? But in case of autistic children, what happens, as I mentioned earlier, that they are too much involved in themselves. That's the reason, what happens, these children or autistic children, they do not want to share their interest with other people. Well, that's something that you can see in an autistic child, that they won't share their interest with others, and they would be too much involved in themselves, right? The next thing is non-verbal communication. So, we communicate verbally and non-verbally, right? So, verbally, when we communicate, we use sentences, we use words, and when we communicate non-verbally, we use certain gestures, right? For example, if I'm upset about something, I would, my facial expressions would change, right? And if I'm happy about something, my facial expressions would change. And a normal child, or if there is normal development of their social and communication skills, they would be able to, understand that if somebody is upset or somebody is happy, or about their emotions by their facial expressions or their gestures. But in an autistic child, what happens, even if you show them facial grimaces, or if you show that you are angry, you use non-verbal gestures, they won't be able to pick that. So they even if you cross the hands and you make facial grimaces, you make a very angry face, they won't be able to understand that you are angry, or you are upset. So that's what happens in in autism, that they won't be able to, understand non-verbal communication. The next thing is social relationships. So, in social skills and communication skills, building relationship is very important, right? This is also a very important part. So as we grow older, we learn these things. So a child has to learn how to build relationships, how to make friends. But in autistic children, what happens? They fail to develop any sort of relation. They fail to build any sort of relationships. And you can see, even if they are able to make friends, or able to develop any sort of relationship, they are not able to maintain that relationship. Well, so this is how the social interaction and communication of an autistic child would be affected. Well, the next thing is restricted or repetitive behavior or interest. Now, we also mentioned this earlier, that an autistic child would have restricted behavior or interest, right? So that means, they would, if, for example, if they're playing with certain toys, they would, they would lining up the toys and repeatedly, and they would do the same activity repeatedly. Also, as I told you that, they would have restricted interest. That means, for example, if they are playing with certain objects, for example, if it is a moving object, or in case if it is sort of numbers or anything, they would be overly focused on that certain object. Now, apart from this, they are also very much fixed on certain routines. For example, their daily routine. So even if it is not made by them, if it is made by their parents or might be teachers or caregivers, but they are very much fixed on that certain routine. So if there is a slight change also in that routine, it upsets them, and they are so they are very much fixed on their daily routine also. And also, apart from this, you can see that these children would be sometimes they would be more sensitive than other people to any sort of environmental stimuli, and sometimes you can see that they are less sensitive than other people if there is any sort of environmental stimuli or any sort of sensory input. Well, so these are the changes that you can see in an autistic child. Now, next, let us move on to the etiology. So, what might be the cause? Now, the first thing is genetic factors. So it is seen that, the prevalence is quite higher in monozygotic twins. So if we compare monozygotic twins and dizygotic twins, we can see that it is, more prevalent in monozygotic twins. So that is also considered as a kind of, risk factors or a etiology. Also, if there are, there is sibling in the family who is autistic, then again the chance is higher. And also, if there is any other family member who is autistic, there is a family history, in that case also, there is a risk that the child might have autism. Next is, there are certain medical factors. So if there is postnatal neurological infections, that can also cause sometimes this, abnormal development or impaired development, which can actually affect the brain's normal development of social and communication skills. Other than that, there is also something which is considered as a risk factor, which is fragile X chromosome syndrome. Now, fragile X syndrome is a genetic condition where there would be, a range of developmental problems, and which includes learning disabilities and also cognitive impairment. So again, if the child is having fragile X syndrome, then there is a chance that the child might get autism, because as I told you that it is a condition where there would be a range of developmental, problems, which includes learning disabilities and cognitive impairment, right? And also in autism, we know that there is lack of social interaction and communication skills, right? So that's the reason, this is also considered as a risk factor. Well, next let us learn about the clinical manifestations of autism. So clinical manifestations of autism is very important. Now, as I told you that it is a spectrum of signs and symptoms, and each child would experience these symptoms differently, right? Each child would be unique. So, there are several signs and symptoms, and we cannot say that there are particular signs and symptoms which would be similar for all children. So, it's not like that. In case of autism, each child would have, different kind of signs and symptoms. Well, again, the first thing is social interaction. So, their social interaction would be affected, right? We already know that. So they would be unable to make any kind of warm relationship with people. And also you can see, which is very evident in an autistic child, that they avoid eye contact. So you can see they would never make eye to eye contact with other people. Also, you would see that they would not respond to their parents. They won't have that affectionate behavior towards them, towards their parents. And also, as I told you earlier, that they would be too much involved in themselves, right? So if they are doing something, they would continue to do that, regardless of who is around them. So even if they are at a social gathering, there are a lot of people and there are other children who are playing, for example, they would not bother about that, and they would continue doing their own thing. Next is impairment in communications. So they would, these children would have failure to develop normal speech, and they would also fail to communicate by gestures. As I told you that we also communicate, non-verbally, right? We use certain gestures, our facial expressions, and with that also we communicate, right? But for an autistic child, it is very difficult, and it's kind of not possible for them. They cannot, communicate non-verbally. They would not be able to develop these gestures. Well, next is behavioral problems. So, again, as we mentioned earlier, that they would have restricted behavior and interest, or restricted activities. So again, if the child would have restricted, repetitive and stereotyped pattern of behavior. For example, if the child is playing with certain object, okay, with certain toys, they would continue to play with the same object, and they would do everything in a particular way. For example, dressing up. So how they have learned it, and they might have learned it from their parents. They have taught them, or the caregivers have taught them, and they would continue doing the same thing. So if there is a slight change also, as I mentioned earlier, that they are very much fixed onto certain routines, right? And if there are slight changes also in that routine, it upsets them. And that's the reason that an autistic child may become anxious or angry very often. And also they would have cognitive abnormalities. So they are poor at symbolization and understanding abstract ideas, and they aren't that creative. Well, next let us move on to the diagnosis. So how to diagnose autism? Now, the first thing is that observing the signs and symptoms, and also listening to the caregivers, because what are the signs and symptoms that they are observing. So they would have a pattern of behavior, right? We already learned that they would do repetitive behavior, and they would have a stereotyped pattern of behavior. So it's very important to listen carefully to the caregivers or to the parents about the signs and symptoms, and that's how autism can be diagnosed. Next, let us move on to the management. So in management, basically, we would discuss that what are the ways through which we can manage these children, because it is a kind of condition which cannot be cured. So we have to learn what are the ways through which we can make it easy for the child, right? So the first thing would be behavioral therapy. Now in behavioral therapy, what we can do, we can develop certain routines, regular routine, which would be easy for the child to follow. Also, we can give positive reinforcement, we can give reward to teach self-care skills, and we can also provide speech therapy or sign language teaching. As I told you earlier, that they won't be able to develop these gestures, right? The non-verbal communication, they would be poor at that. So to help with that, we can teach them sign language, which would help them to communicate non-verbally. Apart from these, we can also provide occupational therapy or physical therapy, and we can also give, sensory integration or auditory integration therapy, and we can also give vocational therapy. And apart from these things, we can also provide parental counseling and supportive therapy, which would be, useful to alleviate the anxiety and guilt in parents. Next, we will discuss about the pharmacotherapy. So there are certain, pharmacological management which is also used for these children. So we can give fenfluramine, which would help in decreasing the behavioral symptoms. So the child might become anxious very often, or angry, or as I told you that if there are slight changes in their routine, also they would become upset, right? And because of that, they might get anxious, they might get angry. So to manage these behavioral symptoms, we can give fenfluramine. And also the child might be hyperactive sometimes. So for that, we can give haloperidol. Well, next let us move on to the nurse's responsibility in taking care of a child with autism, right? So here the first thing which is very important as a nurse is education. So if you have a patient, if you have a child with autism, the first and foremost thing would be education. So you have to educate the parents about the child's condition. You also have to educate the family how to take care of the child, how they can set up a regular routine which would be easy for the child to follow. So basically, you have to educate the family members about the symptoms, about the treatment options, and also the available supportive resources. So what are the supportive resources that those are there with which can actually help the child? The next thing is diagnosis and referrals. So this is also a very important role as a nurse, because as I told you that the diagnosis of autism is done by observing the signs and symptoms carefully, right? And then listening to the caregivers about the signs and symptoms. Right. So you should be, as a nurse, you should be capable of screening children attending the care who possibly could have autism. So basically, you should be capable of understanding the autistic features, and you have to, you have to be capable of observing these features. And the next thing is personal care. So if you are taking care of a child with autism, you have to guide them about self care, how they can, they can take care of themselves, how, they can take care of their hygiene and also safety. Well, that's all about today's class. So let us conclude our today's topic here. So today we learned about autism spectrum disorder, in which the child's social interaction and communication skills would be affected. Also, it is a neurodevelopmental disorder which leads to, because of which there would be social disorder. The child would be removed from social interaction and communication, and in this, the child would be too much involved in themselves. So, I hope you have got a better insight about the topic. Thank you.